The state of Missouri has some of the lowest vaccination rates in the country, and tonight they're experiencing a surge in COVID-19 hospitalizations. Some hospitals are even being forced to put out emergency calls for ventilators. Joining us now is Erik Frederick, the Chief Administrative Officer at Mercy Springfield Hospital. Thank you so much for your time tonight.
Linsey, appreciate you having me on. Thank you.
Missouri is part of a group of 4 states where the Delta variant accounts for a staggering 81% of new COVID cases. You've admitted dozens of new COVID patients in the past few days. Do you have the resources at this point right now to deal with this influx of patients?
We do. Thank you for asking. Towards the end of last week, we knew that we were going to be running short on some specific equipment supplies. So we're part of a large health ministry here in the Midwest, and we called out to our colleagues in St. Louis and other areas, and we're able to resupply as we knew we were going to need that. And as of today, we stand well supplied and equipped to care for the patients that we have in the hospital.
And you've said that we never thought we would be back here, but clearly low vaccination rates are fueling some of the spread. What are your patients saying as far as why they aren't getting the vaccine?
So we have conversations with patients now that are saying they wish they had. We've certainly had some of those stories in our hospital, but I think people still feel like this is either not serious enough to warrant getting a vaccine. There's distrust of the vaccine. People feel that as long as it's under emergency authorization, that they want to see it longer or fully approved to get that confidence in the vaccine. And there are some people that we know just see this as more of a personal choice. And their position is they will never take a vaccine. And I think the more we ask them, the more they dig in. So it's a variety of answers, but what that all leads to is very low vaccination rates and high hospitalizations for us right now.
And as you see the rest of the country now approaching some semblance of normalcy, major cities like New York dropping all COVID restrictions, people going back to work, what's your explanation for the disparity? Is it entirely explained by those who are just not getting vaccinated?
I believe so. I think we can all look at that and draw that direct correlation of the low vaccination rates and high hospitalizations. The vaccine's proven to be effective against not only the illness, but hospitalization. So there certainly are people that are fully vaccinated that get hospitalized, although for us that's been less than 4% of our COVID admissions. But even if they're hospitalized, they're not as sick. We've not had fully vaccinated people in our ICUs level or having a higher level of care that needed when they come to the hospitals. We just know it's effective against getting sick. It's effective against serious illness and hospitalization. Less
than 4% of those getting admitted have been vaccinated. That's right?
Correct.
And what's the morale like for your doctors and nurses there?
The whole team is tired. We just went through this barely 6 months ago when we peaked over the winter. I think the difference then was the path forward was unsure. And now we have something in hand that can help prevent this, and it's really personal choice that's preventing us from getting there. And that's very frustrating. I think as a healthcare system, we look forward and we want to make sure the community is protected. We took that step today by announcing that we're mandating coworker vaccines across our ministry, and that's close to 43,000 coworkers across multiple states, multiple clinics and hospitals. So we think by leading as a large organization, hopefully others will follow us in the community, and especially other businesses and healthcare systems that will say, yeah, that's the right direction to go, and we can continue to educate and influence and lead the path for the community to go towards those vaccinations because they're available and they're free. There's really no reason left to get it other than just choosing not to.
And you said specifically personal choice, but does it at all appear to be political as far as people who are deciding not to get vaccinated?
Yeah, I'll just clarify. We know that there's certainly a segment of society that's not going to be able to get the vaccine. There'll be medical reasons for that. And what we do is encourage people to talk to their physicians, get clarified. But what we see locally, and we know through some research at our hospital association level, that there is a segment of the group of the community that has politicized it, and they feel like this is someone else's plan, or they have beliefs about the vaccine and COVID that this is manufactured and not true, and they just won't accept it no matter what we say. In my mind, it's this is a vaccine that was brought to market by a Republican president, and it's being delivered by a Democratic president. It's a bipartisan effort. If I've ever seen one. They both got the vaccine. They're both doing fine. I don't understand how people still stand on one side or the other and say this is the issue, but we clearly see that in our community.
Is there a lesson that the rest of the country can take from what's happening in Missouri right now?
Continue to encourage vaccines, because this could be your community. If you look at our vaccination rates and compare them to your own vaccination rates, that's the I think that's the case study that we're kind of presenting to the entire country right now. We're busy this time of year. It's a busy community. We want people to enjoy being together and doing the things they want to do, but vaccinate yourself. That's really the way forward. So if you're in an area with lower vaccination rates, look at us or look at places that have high vaccination rates, and you can pretty easily draw that conclusion that vaccines are the way to go.
Well, perhaps people are taking note of what is happening there in the Show Me state of Missouri. Mercy Springfield Hospital Chief Administration Officer Erik Frederick, we thank you so much for your time tonight.
Thank you. Appreciate your time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.